Are you a healthcare provider to infants and children under the age of 5? Let's take a few minutes to learn more about the Special Supplemental Nutrition Program for Women, Infants, and Children, commonly known as WIC. The WIC program aims to safeguard the health of women, infants, and children up to the age of 5 who are at nutritional risk by providing nourishing foods to supplement diets, information on healthy eating, and referrals to healthcare and other community services. Why WIC? First and foremost, WIC is dedicated to health equity and reducing health disparities. Research suggests WIC participants are significantly more likely to receive adequate prenatal care, and participation is associated with lower infant mortality rates among Medicaid beneficiaries. Other successes include improvements in overall pregnancy outcomes, reduced incidence of anemia in young children, lower rates of low and very low birth weight babies, and higher rates of immunization against childhood diseases. Second, our WIC staff, which includes registered nurses, registered dietitians, nutritionists, IBCLCs, and trained paraprofessionals, are there to support families with individualized nutrition information. This includes general nutrition information and tailored information for families, like insights on how to maintain a healthy diet while pregnant, tips on transitioning a baby to solid foods, or even help with encouraging picky toddlers to try new foods. WIC also assists families who choose to breast or chest feed. Each agency has a designated breastfeeding expert, and our staff participates in breast and chest feeding training every year. If you have a patient who needs support or education related to breastfeeding or pumping for an infant, let us help. Studies have shown WIC participation increased breastfeeding initiation and duration rates. WIC is connected in the community. Some families need assistance with things WIC cannot provide, but we always do our best to refer to other programs that may be able to help. Last but not least, WIC is dedicated to ensuring children have access to foods that promote healthy cognitive and physical development. WIC foods have been researched to help improve energy and reduce or treat vitamin deficiencies. The foods we offer are based upon National Academy of Medicine recommendations to provide good sources of iron, vitamin C, calcium, and protein. The food benefit may be what people are most familiar with, but it is also the aspect of WIC people have a lot of questions about. We are not just a formula or food program, we are a nutrition education program. Here is how it works. WIC offers food package prescriptions that are tailored to the participant's specific nutritional needs. Benefits are loaded onto an EBT card people can use at the grocery store. There are no vouchers to keep track of, and benefits do not have to be used all at once. It has never been easier to use WIC. While infants can receive baby food, formula, and cereals, we are here to help families nourish their children up to age 5. WIC foods are everyday foods that are selected for the essential nutrients they provide. Participants have a cash value benefit for them to choose the fresh, frozen, or canned fruits and vegetables their family enjoys. They can also receive 100% fruit juice because vitamin C helps increase iron absorption, peanut butter, eggs, milk, cheese, yogurt, or tofu, iron-fortified breakfast cereals, whole grains such as whole wheat bread, buns and pasta, brown rice, corn, or whole wheat tortillas, bulgur, and exclusively breastfeeding participants receive an enhanced iron-rich package that includes canned fish. WIC makes it possible for people to save money while still providing nutritious foods to their families, but the support doesn't end there. Don't forget, WIC provides nutrition information, even recipes, tailored to the participants' individualized needs. Now that we have gone over all the great things WIC has to offer, who is eligible for WIC? It's more people than you think. To be eligible for WIC in the state of Illinois, the participant must live in Illinois, but they do not need to establish permanent residency first. New arrivals are welcome to apply. To sign up for WIC, a person must fall into one of the following categories: pregnant, less than 6 months postpartum or 6 months from a loss of pregnancy, breast or chest feeding an infant less than 1 year old, or they must be a parent or guardian of an infant or child under the age of 5. That's right, the person who enrolls the child does not have to be their mother. Either parent and any legal guardian of an eligible child, such as a grandparent or foster parent, can apply. The adult or the child in their care must also be determined to be at nutritional risk by a health professional such as yourself. The risk can be medical, such as anemia or an acid reflux diagnosis, or a dietary risk, such as food insecurity or unhealthy eating practices. Did you know if your patient is a current SNAP or TANF recipient or enrolled in Medicaid Title 19, they are automatically income eligible for WIC? WIC is also able to serve eligible persons who are at or below 185% of the federal poverty guidelines with proof of income. Your patient only needs an official form of identification, such as a driver's license or birth certificate, proof of residency if their identification does not also have their current address, and proof of income. WIC staff is ready to assist participants with selecting the correct documentation for their first appointment. The average WIC participant will have 4 appointments per year, one every 3 months. For most families, the first and third appointment are in person, while the other 2 may be virtual or over the phone. Between appointments, participants will engage in nutrition education and have access to additional resources through our WIC health system. Ready to refer? You can access the WIC Health Information and Referral Form on the IDHS website. If you aren't already connected with your local WIC office, let us help. We can provide you with referral forms, handouts, brochures, and even posters. When your patient is ready to apply for WIC, the first step is to call their preferred clinic and schedule a certification appointment. To find the WIC clinic closest to you, use the IDHS Office Locator tool at www.dhs.state.il.us or call the State WIC office at 217-782-2166. And remember, WIC is with your patients until age 5.